One of the many side effects of this pandemic is an increase in drug overdoses, especially opioid overdoses. Physical distancing and isolation have taken a huge toll on the mental health of many people struggling with addiction and has changed how they get treatment and counseling. Heather Yourex-West spoke to some of the families caught in this dual health crisis.
Sean Richards began March on a positive note. He was finishing a 3-month rehabilitation program for opioid dependency and was regularly attending Narcotics Anonymous meetings. But by the end of April, Richards was dead.
I went to Sean's house because he hadn't been in touch with anybody, and I found my son passed from a fentanyl overdose.
Richards had finished his rehab program just as physical distancing measures began to take effect. His meetings went online, and like so many, Richards began to isolate at home, alone.
Not being able to see family or friends, and said to me, "Mom, I feel like I'm being backed up against a wall."
We're in a really, really difficult moment because the COVID pandemic is intersecting with the opioid crisis in some of the worst ways possible.
While we don't yet know the full impact physical distancing policies have had on overdose rates, the early numbers are grim. In March and April, British Columbia saw more than 230 overdose deaths, its highest numbers in a year. In April, overdose deaths in Toronto hit a high not seen in 3 years. And between April and May, overdose-related emergency room admissions in Edmonton rose from 9 to 14 a day.
With COVID arriving, people haven't necessarily been able to access or to use the services that they were.
Places like this overdose prevention site in Red Deer, Alberta have remained open during the pandemic, but to ensure physical distancing is possible, capacity has been cut in half. As a result, the Turning Point Society says fewer people are using the service.
We have heard of more fatalities. We don't have that data from the coroner or anything yet, but we have heard of an increase in fatalities.
It's absolutely heartbreaking because I know that could be my son.
Last month, Angela Staines received the phone call she feared most. Her son, Brandon Shaw, had overdosed in Abbotsford. BC health officials have warned that travel restrictions may be making the street drug supply more toxic. Fortunately, Shaw wasn't alone when he overdosed. He was given naloxone and taken to hospital, and he survived. That's something that haunts Joanne Logue, that nobody had been there when her son had taken that final, fatal dose.
Because I lost my boy. Yeah, I lost my son, and I think it could have been prevented if things were opened up to him.
Heather Yourex-West, Global News, Calgary.
Tomorrow, Heather looks at how mental health services are adapting to this new reality and how to ensure safe supplies of alternatives to illegal drugs.